Hello, my name is Firdaus. I'm from Group 10. So right now I will talk about how to evacuate urine drainage unit. So drainage unit is is for patient that like a bedridden patient. It's for maybe patient that have chronic illnesses that cannot be moved, that cannot move. Or maybe also can for the patient that paralyzed. So they have specific bag that connect to their the urine organ with catheters, and they have a specific bags that contain their urine. So as a nurse or as a medical student, you have to know how to drain the bag of the urine. So what we need, the equipment, we need a urinary drainage unit, of course. We need the antiseptic wipe. We need the cloth. We need a container to put the urine, and then we need a glove, of course. Okay, first the procedure. First, you put on your gloves. Of course, we want to avoid the infection from the urine, and then we put a cloth under the urinary drainage at the floor, and then we take the container and then put under the urinary drainage. At the urinary drainage, we have like a drainage. We have to open it. After we open it, and then we slowly make the urine flow out from the urinary drainage to the container till the urinary drainage is empty. And after all the urine have been flown out, we wipe the drain with an antiseptic wipe, and then we close the drainage, of course, and we put it back to the catheters at the side of the patient. And then for the urine that we have take it out from the bag in the container, right? So we have to look at the volume of the urine and look at the concentration of the urine, the color of the urine, and then record the observation that we have done. Okay, that's it for me. Right now, I will talk about how assisting the patient with depression. So depression is a common and very dangerous mental illness from most of the patient. So depression can affect the patient from how they act, how they feel, how their emotion is. So what is the cause of the depression? So depression is caused by what the medication the patient take, what the substance that patient take, and then stress from head injury and from maybe abuse. So usually when depression, patient may always talk about they want to commit suicide, they don't want to live, they're feeling trapped, they don't have a solution in their life, they don't know what to do next, and then maybe they feel there is a burden to another people, like that. So when you encounter with a patient that have depression, there are some maybe tips, maybe things that you cannot do when talk to the patient that have depression, such as you cannot compare the feeling of you and your patient, because sometimes you don't understand. You feel like, oh, you understand the patient feeling, but actually you don't never understand the patient feeling, and then the patient feel like, oh my god, what is this person doing? They make the patient feeling worse, like that. And then next, advice, don't give them life advice that very cliche advice, because everyone knows the cliche advice, such as the patient said, oh, I want to commit suicide, and then you said commit suicide is not good, don't do that, it will make your life very bad. All people know that, the patient also know that, so we no need to tell them what they have already know. Okay, so what you need to do. So first, when you encounter with the patient that have depression, you sit properly in front of them and then ask them, are you feeling okay? You have any problem you want to tell me about? I can hear a problem for you, like that. Ask. Normally like no, don't pressure the patient, don't pressure the patient to tell me what you're depressed about, okay, like that. And then when the patient tell already the problems, we have to hear carefully, active listening. And then when the patient said, oh, my mother have died yesterday, so you don't need to say like, oh, I understand your feeling. No, you have to say like, oh, I'm so sorry, I feel I'm so sad for the bad news of yours, like that. You have to feel empathy of the patient, feel what the patient feelings, like that. And then maybe the patient very sad, and then you want to help them more furtherly, like ask the patient, you need some help from, maybe you want some friends or your family member accompany you right now, so you ask them. And or maybe you can do a small gesture, like you give them some water, you relax the patient, and then hear the patient problem, like that. Okay, that's all from me.